Good morning, everyone. My name is Garry Pezzano, and I'm the President and CEO of LeadingAge PA. Thank you so much for joining us to advocate for the future of aging services. A couple special thank yous to House Majority Leader Matthew Bradford, State Senator Judy Ward, the Chair of the Senate Aging and Youth Committee, and State Rep Maureen Madden, Chair of the Aging and Older Adult Services Committee. Thank you for being here with us, thank you for your support, and thank you for the comments you're going to share. Before we begin, I'd like to bring your attention to some of the art that surrounds us. So if you look behind you there, that art was created by residents from member communities of LeadingAge PA. This is a testament to the contribution of older Pennsylvanians. And I hope you stick around after the press conference to really take it in and appreciate it. So let's go ahead and get started. Please welcome House Majority Leader Matthew Bradford.
Senator, how are you? Good. Thank you, Garry, and thank you, Senator Ward, and thank everybody for showing up today and talking about an issue that's critically important as we begin the last few weeks of June and obviously our constitutional obligation to pass a balanced budget, a budget that is not just balanced in terms of dollars and cents, but balanced in terms of our priorities and in terms of delivering for one of our most vulnerable populations, but one of our most beloved populations, which are our seniors and our parents and our older Pennsylvanians who need a little bit of help. And I want to thank the folks behind us, the caregivers and the administrators who make sure that older Pennsylvanians get the skilled care that they deserve and need, that all Pennsylvanians would want to have the dignity and grace in our older years. Obviously, in a budget year where we are blessed to have additional dollars, we need to make sure those dollars go to those populations that are most in need and most deserving, and not just for the folks who are receiving the care, but make sure that the caregivers, the workforce, and the administrators who provide that care are able to give the same type of dignity in the work that they provide. This year we have an opportunity, and yet we have an obligation to make sure that we provide the right level of service in those facilities, but also that we provide the right level of funding in this beautiful building to make sure that these folks can do the work that they are willing to do for our parents and our loved ones. I'm going to be brief, and I know Senator Ward and our Aging Committee chairs in both the House and Senate are working diligently to make sure that we have a budget this year that does right by every Pennsylvanian, especially those in skilled care. I want to thank Senator Ward again for her leadership. We miss her very much in the House, but some make the mistake of crossing the chamber. But sincerely, I want to thank everyone again for coming out, the work they do, and know that we're going to be working very diligently in the next few weeks to make sure we have a budget that respects the values of every Pennsylvanian. And with that, I'm going to turn it back over to Garry.
Thank you very much.
Thank you.
Appreciate it.
Apologize, I have to duck out.
Thank you.
Thank you.
Thanks so much. Thank you. Appreciate it.
Thank you, Leader Bradford. Now please welcome to the microphone State Senator Judy Ward, Chair of the Senate Aging and Youth Committee.
Good morning, and thank you. What a pleasure to be here with all of these young at heart individuals. I'm just so grateful. As mentioned, I'm the majority chair of the Senate Aging and Youth Committee, and myself, along with the minority chair, Senator Maria Collette, wanted you to know that we are committed to helping our long-term care facilities and residents that are living in Pennsylvania. And as representatives of LeadingAge PA have emphasized, there are currently many efforts to promote independent living and community health care services across the Commonwealth. But there is still a very vulnerable portion of the population which is deemed nursing facility clinically eligible and dependent upon availability of enhanced care. Nursing homes and life providers are most appropriately positioned to care for those individuals who can no longer reside safely at home or who require dedicated care management and services in order to do so safely. The funding increases advocated by LeadingAge PA would have significant impacts on our seniors. Specifically, the funding would be used to hire additional staff who could serve more residents, thus easing the burden on the acute care partners in the entire community. In addition, the funding would enable facilities to increase wages of providers currently on staff, which is a critical factor in retention, and also increase starting wages for new staff. As advocates, legislators, and citizens, we need to work together to ensure that the long-term care industry in Pennsylvania is not only stable, but capable of growth. To those who say now is not the time to address the financial challenges faced by nursing homes in our state, I ask, if not now, then when? Long-term care facilities are already shutting down beds, wings, and even the doors in the face of expanding financial and staffing burdens. Realistic solutions must be found and effectively implemented sooner, not later. Tens of thousands of seniors across Pennsylvania depend upon skilled nursing facilities for care. For many, it is their only option. Most certainly, the inclusion of LeadingAge PA's funding request in the 2024-2025 state budget is an important and necessary advancement in the resolution of long-term care's financial crisis. I encourage my legislative colleagues to view these budgetary requests not as expenditures, but as investments in older adults who deserve access to professional care that is distinguished by dignity, respect, and compassion. With deep appreciation for the services provided by long-term care facilities throughout the Commonwealth, I will continue to do all that I can that this vital network is reliable, impactful, and accessible to those in need. Thank you so very much for allowing me to be here today.
Thank you, Senator Ward. Now please welcome State Representative Maureen Madden, Chair of the Aging and Older Adult Services Committee.
Good morning, everyone. As mentioned, I'm State Representative Maureen Madden, and I represent the 115th Legislative District in the beautiful Pocono Mountains. I also have the great privilege of serving as the Majority Chair of Aging and Older Adult Services. Let me begin by saying it's wonderful that you are all here today, this morning in Harrisburg. Thank you for being here. As the chair of the Aging Committee in the House, one of my top priorities is to ensure older Pennsylvanians have the ability to age with dignity, the ability to age in the comfort of their homes and be surrounded by the familiarity of your local neighborhoods, because it plays such a pivotal role in the lives of our loved ones. For our seniors unable to remain in their homes, we need to support our nursing homes where understaffing and underfunding is at a crisis level. It is imperative that we adequately fund our service providers to ensure seniors have as many high-quality care options as possible. Yesterday afternoon, I had the opportunity to spend time with a few of the artists from the Ageless Art and Timeless Treasures. Composition number 7, which is right over there, is the work of Leonard Michaels. It is an intricate and interesting piece, and he's working on a new piece entitled Old People. Can't wait for that one to come out. During COVID, Annette Pennington painted a stunning work in acrylic, which you can find over there, of a mansion she saw every day out of her back window. She titled it My Happy Place. Terry Slider, who is sitting right here. is an artist of the piece titled Bloomburst. It is a beautiful painting by a talented artist who happens to be vision impaired. And if I am correct, one of her eyes is 2,800? Yes. And with the help of her friend Annette and her community, she is able to paint and do the work that she loves that keeps her happy and fulfilled in her life. I'm going to share a personal story about the LIFE program. Before I was elected to the House of Representatives, I had two jobs. I was a communications professor at East Stroudsburg University, and I was my husband's business manager. My husband is a talented acoustic guitar player and singer whose day job is entertaining seniors in nursing homes and daycare facilities Life Geisinger, which is a facility he has played in for over 10 years. And as his booking manager, some years they could afford $100 for Roy to play. Some years they could only afford $75, and when they could only afford $50, he said, well, Mo, how low do I go? And I said, well, it's for seniors, right? And it's only in Scranton. So we'll go as low as $50 because when they have the money, they will be able to pay you. So fast forward a decade later, and I'm the majority chairwoman of Aging and Older Adult Services, and I want to tell you that I am going to be your biggest advocate to continue these programs, continue the important work that LeadingAge PA does, because it is so valuable and so important to the emotional, physical well-being of all of our seniors who have joined us today. So thank you for being here, and have a great day, everyone.
How wonderful to have such champions. Thank you, Representative Madden. Now please welcome Vicki Loucks. Vicki is the chair of LeadingAge PA Board of Directors and COO of Redstone Presbyterian Senior Care.
Thank you to Chairwoman Madden, Chairwoman Ward, and Leader Bradford. And thank you all for being here to support the sustainability of this essential cause, ensuring that our elders across the state have access to high-quality care and services when they need it most. I began my career as a registered nurse and have since dedicated my life to serving seniors. Today, I'm the Chief Operating Officer at Redstone Presbyterian Senior Care in Westmoreland County. I'd like to share why advocating here today is so important in our community. Every day, we assess our staffing levels versus the referrals we have from hospitals. Many days, we're limiting those admissions due to staffing shortages, even when we're offering pay incentives to pick up those extra shifts. Without proper Medicaid funding, we cannot compete against other employers, which creates a sad reality that it's more cost-effective not to fill a bed. Our skilled nursing facility has one of the best reputations in Westmoreland County. That's why it's so disappointing when we can't provide services to all who need them. That also places a strain on the acute care system, where we're seeing long wait times in emergency departments because patients are waiting for post-acute beds. In fact, hospital data shows us that the average length of stay for patients waiting to be discharged to a long-term care facility has increased by nearly 2 days in the past 4 years. The pandemic may be over for some, but we're still dealing with the harsh reality of the economic fallout. Our temporary staffing agency costs have skyrocketed by a staggering 245%. Because of this, we can't execute on plans that require investment, such as the development of more housing, capital improvements at existing facilities, and resident wellness programs. There are days when closing our nursing homes seems like the best solution, as we struggle with staffing, infection control, and inflation. But then we think about our residents and the wonderful people that they are, and we stay in the fight. What might have happened to them if they had not received the care they did while they were at Redstone? This is why we need support from those in state government. We need a reasonable Medicaid increase in this budget cycle, or more seniors will lose access to high-quality care and services that they deserve. Now I'll turn this back over to Garry Pezzano.
Thanks, Vicki. Thank you, Vicki. Thank you, Leader Bradford, Chairwoman Ward, and Chairwoman Madden. And to everyone here today, along with all the professional caregivers back in their communities who are doing the hard work, the compassionate work of caring for our seniors, that's why we're here today. Over 25 nursing homes have closed in our state since the pandemic. That represents over 2,000 older adults who were displaced from their homes and lost access to the care setting that they and their families chose. Over 2,000 good Pennsylvanians who did not deserve this and who experienced a preventable disruption in their care and in their lives. And this is just the tip of the iceberg. In the nursing homes that remain, beds have been decertified, hospital transfers have been halted, and wings have been closed, which represents tens of thousands of potential residents who no longer have the option to move into these communities. Nonprofit and mission-driven communities, often with faith backgrounds, that compel them to strive for the highest quality of care and to treat residents as an extension to their own family. Standing behind me are residents who call a continuing care community their home, who are rightfully concerned about their futures. Also behind me are mission-driven operators and passionate senior care leaders who have had to make painstaking decisions just to keep their organizations afloat. These are not the nursing homes that we want to see limit access. These are not the nursing homes that we want to see close. These are the nursing homes that on a regular basis I enthusiastically recommend to the people I know. And with all this going on, we cannot ignore the other settings that make up the aging services ecosystem, all of which are facing similar obstacles. For example, the Living Independence for the Elderly, or LIFE program, provides an option for older adults to live independently in the community while receiving services that meet their social, personal, and health needs. It serves as an alternative to a nursing facility, as an alternative to Community Health Choices program. But like nursing homes, LIFE programs have been grossly underfunded and are unable to provide services to more older Pennsylvanians like they were designed to do. Here's the root of the problem. Aging service is battling for funding. It's a funding crisis and a workforce crisis. And this has led us to where we are today, an access to care crisis. And what we know about a crisis is that it requires immediate response. Medicaid rate increases in this budget cycle and serious attention toward creating a pipeline for senior care workers. Now, in just 1 month, nursing homes in Pennsylvania will be required to meet staffing ratios that are insufficiently funded. Today is about responding to the crisis that jeopardizes access to care for older Pennsylvanians and insisting on $70 million for nursing homes and at least $8.9 million for LIFE programs included in the upcoming state budget. Pennsylvania has an opportunity to respond to this access to care crisis, to do the right thing, to honor their citizens. Make no mistake, without funding, there is no workforce. Without a workforce, there is no care. Let's get this done now. Thank you. Thank you for your attention, and this concludes today's event.